Special needs patients are special for many reasons. One being that it is very difficult for them to find medical care. Today we are here to talk about special needs patients and dentistry. Now, people often have an impression of what they think a disabled patient is. Kind of tell the audience really what the definition of a disabled patient is and what they can expect if they saw one.
We have people with different syndromes. We have people with so many different systemic problems that is not only behavior problems. So it's really hard to give a specific definition, but we see a broad wide of patients.
So there is a range in terms of what you're dealing with when you say I'm going to work with these patients.
Yeah.
And what are the primary oral health concerns that you see, Dr. Thorne?
Well, as Dr. Soler was saying, when you talk about special needs, it is a wide range. We have, of course, mentally challenged is probably one of our largest populations. We have patients who have cerebral palsy, another large part. Some of the genetic disorders, Down syndrome is one of the biggest. Autism seems now to be one of our larger, fastest growing special needs population. Generally what we see is we just see a need for improvement in oral hygiene. A majority of these patients aren't able to take care or do not have the dexterity or do not have the understanding of the need to take care of their dentition. So I guess the number one problem that we encounter is just home care and the prevention of periodontal disease, prevention of caries.
So would you say that their needs then are needs that could be met by pretty much any general dentist?
For the most part, I think a large percentage of these children and adults that we see can be managed by a general dentist. Of course, there are those who need specialized care, maybe for behavioral issues. That's generally why they need to have some specialized care. But for the most part, I think a large majority can be managed by a general dentist.
In talking with the patients and caretakers, the thing that I'm sure you've heard over and over is we can't find anybody to treat us. Why do you think that is?
I will say, I mean, lack of knowledge, and there is a lot of fear of treating them because they don't know what they're gonna face. So, but that's something that we don't realize as general dentists when we're treating the general population, probably because communicating with them is a little bit challenging, and sometimes you cannot communicate the way that you wanted to, but I think it's more fear of what they don't know what's going to happen.
You know, one of the things that I was reading about was that dentists had a concern about not being trained in how to treat these patients. So from when they go to dental school, sometimes it's not integrated into the dental school program. And there are continuing education courses, I understand, to address that in some areas. Now, for the person who has had the training, I saw in my reading that some of the other reasons why they wouldn't see these patients was, like you were saying, Dr. Soler, just having to worry about office accommodations, disrupting the normal office routine, and then financial compensation. So what would you say to that, Dr. Thorne?
I think you hit every one of those, you hit the nail on the head. Most of it is just accommodating patients in their practice. I think when someone calls or somebody calls in to make an appointment and the caretaker or the parent indicate that it's a special needs patient, I think one of the first things that comes into mind is what kind of patient am I going to be dealing with? It is a disruptive patient. They may be wheelchair bound. How am I going to deal with that? I think it's just a general fear that we have in what we're going to be facing when they come into the office. And without the training and without the experience, it's understandable.
So if I'm a general dentist and I'm watching this and I said, well, I maybe can, if their problems are usually oral hygiene related, I think I could handle that, but what should I do then if I wanted to maybe have someone in my office who's maybe, you know, on the disabled scale, not at the point where they're a behavior management problem, but somebody that I could manage in the office? What advice would you give me?
Well, I would say that most of the advice that I would give, and teaching students in school, I tell them to try to get as much information over the phone about the patient if they know it's going to be a special needs patient, to get as much information as they can about what they're going to be dealing with. If it's a child or an adult and they've been to several dentists and the dentists were not able to manage them, then that's definitely an indication they need to refer them. But I think you can get most of the information you need over the telephone from the caretaker from the parent as to how they expect, how well they're going to behave, what their needs are. And also if the caretaker or the parents are able to brush their teeth. Oftentimes they may be so disruptive at home or in a group home setting, depending where they are, that they may not be able to manage the oral hygiene.
Right. Dr. Ballman, what are some of the challenges and then some of the joys that you face in treating these patients?
Challenges sometimes is that when they are kids in big bodies, they're really strong. But at the same time, they usually come with caregivers who are very helpful, and they really help you to manage the patient, at least to transfer the patient to the chair and to put him on the chair and help. That's a big help, because that's one of my biggest fears when I see somebody bigger than me. How am I going to treat this person? And my joys are they really appreciate what you do for them. They are people who really appreciate it, who really say thank you from the bottom of their heart.
I think it's just the joy of knowing that you're helping someone who otherwise may not be able to get the help they need. But it's also rewarding in the fact that parents are appreciative. They may have been around trying to seek care, not able to get it, and they come in and they find a group of people who enjoy what they do, treat their child with great respect, treat them gently, and at the same time try to provide the care that we need to provide. So I think it's both. It's a reward for us, and I think just seeing the parents and the expressions on their face and just enjoying what we're able to do for them.
One more thing, I'm sorry, that I will say is they understand that sometimes you cannot accomplish all what you have planned for, but they appreciate to the point that you get.
In the article that I was reading in the ADA about special needs patients, the writer of the article said that it would do a lot to alleviate the problem if every dentist just saw one special needs patient. People don't realize it. Just see one, what a huge impact that would make. In closing, what would each of you say to dentists that aren't doing anything to try to get them to see that one patient?
I will say, just give it a try. I mean, not everybody is the same way. Nobody's going to behave the same way. But they need to give it a try, at least one patient, and they are going to feel the joy that we feel.
And the same thing, I usually try to encourage dentists to accommodate as many as they can in their practice, because a lot of these individuals live in communities, and it's easier for them to seek care in the community. It's easier for them in terms of transportation, cost, convenience. And so when I talk to dentists or in a CE course or talk to the dental students, I tell them at least try. And if you get the correct information over the telephone, you'll find that the ones that you can treat, the ones you can accommodate, you should at least try to take care of those. And I also tell them there's some that you're not going to be able to treat, and you shouldn't feel guilty because you can't manage them. But at least I think it's important that they try, because of the very fact that we want these patients to get care in their community.
Well, thank you very much for the interview.
You're welcome.
And hopefully the audience out there will get something out of that.
I hope so.